Okay, what has a uniformly enlarged, soft, globular uterus? It's going to be your adenomyosis. So here we'll do a little practice question and we'll look at a little image so we can cement it in our brains. So here we have our 42-year-old woman and presents with heavy, painful menstrual periods that have worsened over the past year. She's also got the chronic pelvic pressure. Her menses are regular but associated with intense cramping, and she's got this uniformly enlarged, soft, and globular presentation here in her uterus. So what is the most likely underlying cause? And it's going to be our adenomyosis. So now let's kind of dive in and explain what this mechanism is and why the other ones are wrong. So our gross pathology, we're going to have an uniformly enlarged and a soft globular uterus. So here's our endometrial glands in the myometrium and our adenomyosis, and here's a normal kind of side as well. So you can see they're kind of implanted here in the myometrium, and that's why they're going to be enlarged compared to the fibroids, which cause the nodular and the irregular enlarged uterus. So we have heavy periods, painful periods, chronic pelvic pain, and our uniform uterine enlargement, and it's seen in women who are older than 40. Endometriosis is going to be a uterus of, let's type this out, normal size. Normal size uterus. That's the reason why it's not going to be it. Endometrial hyperplasia, that's the overgrowth of the endometrial lining, not the muscle. And so it can cause bleeding, but the uterus typically is not enlarged or soft. All right, so it's going to be our answer choice. Uterine fibroids, leiomyomas. Okay, these guys are benign smooth muscle tumors. Smooth muscle tumors. And the uterus is enlarged, but it feels firm and irregular. So like lumpy. And it's not going to be soft or globular is the word you look for here. It's not going to be globular. It's not going to be soft. Endometrial carcinoma. Okay, so this is going to present with post-menopausal bleeding, and it can cause irregular uterine enlargement, but that's not going to be uniform. So basically what's happening is we have the lining of the uterus growing into the muscle wall. It makes it super uniformly big, soft, and round, like globular. That's a super important word, globular, for the adenomyosis. And it causes the painful, heavy periods. It's going to be really painful, and pelvic pressure is going to increase. And so it's going to be the muscle invaded by the lining. So you have a big, soft uterus with a lot of pain. All right, that's pretty much all there is to say about this one. If this is helpful, then please like and subscribe. We'll see you in the next one.